All right, guys, this is Dr. Ravi, board certified plastic surgeon in Houston, Texas. And today we're talking about the arm lift procedure, otherwise known as a brachioplasty. So for a lot of people, their arms are a big source of insecurity. And especially in this day and age with these medications that help people lose weight, specifically the GLP-1 class of medications, such as the semaglutide and the tirzepatides of the world, weight loss can lead to specific areas of skin elasticity, specifically in upper extremity and the arms. And so when we talk about arm contouring, plastic surgeon, I'm looking at two things. We're looking at the areas of fat in the arm and the areas of loose skin. So in some cases, for a lot of people out there insecure about their arms, I frequently see patients who come in thinking they've got excess fat, but really when you examine a patient, they come in the office, a lot of the times that excess fat is actually excess skin. So when there's more loose skin than there is fat, the reality of the situation is that in order to get the best result, create that right, nice, skinny, athletic toned arm, we have to talk about removing skin, and removing skin then requires a scar. And so when we talk about the arm lift procedure, when somebody has more loose skin than fat, you can actually, there's really typically two places where I like to talk to patients about putting their scar, and I give patients an option. Ultimately, there's always going to be a visible scar, but then if you're talking about wearing tank tops, we sit down and have a discussion of what kind of clothes you're potentially going to wear, and based on the kind of clothes that you're going to wear, we have a discussion about scar placement, which is a critical part of any surgical procedures, but specifically arm lift surgery. We can either place that scar on the inside of the arm, or that scar can be placed halfway between the front and the back. And those are the two most common areas where I like to place a scar, and I give people an option. In addition, if it's just loose skin and there's very little fat, then an arm lift procedure can create an amazing result. Some cases, there are other areas of fat in addition to areas of loose skin. In that case, I like to combine liposuction along with the arm lift to really decrease the circumference of the arm and create the most athletically toned looking arm possible. Typically, the areas in women are the areas of the deltoid where there's some fat pockets, and so actually liposuction in the deltoid creates a thinner frame from the front. So when you put your arms down by the side and have liposuction in the outer arm, it actually makes you look narrower. So it creates a better illusion to the torso by liposuction the outside deltoid if there's fat there. And then of course we can also remove the skin on the over the area of the triceps. And so when we talk about who's a great candidate for it, we talked about massive weight loss, patients who are on GLP-1 medications, patients who've had surgical bypass surgery, or any type of weight loss surgical procedures, but really just weight fluctuations. It doesn't really matter how you've lost the weight or the weight fluctuations, whether it's with medications, whether it's surgery or diet and exercise. The reality is you may have some loose skin in the arm, and it really doesn't matter how it happened, but reality is sometimes it just is there. And so in terms of recovery associated with an arm lift, typically we're looking at probably a few days of discomfort. I have a very effective pain protocol that I'm well known for, and when you guys come to the office, we sit down and talk about what this pain protocol is like. But essentially, very little discomfort after surgery. Because you are using your arms, and we take for granted how much we use our arms, there's no limitations on what you can do afterwards, but we just don't want you lifting anything heavier than 10 pounds for 6 weeks while that scar heals, because if we're pulling and stretching, we may have some healing issues that we're trying to minimize and avoid. Normal activities are fine for a few days of a little bit of discomfort. Most of the swelling goes away. Swelling peaks at about 2 weeks with the arms, and over the course of 6 weeks, the swelling really subsides. I tell patients that you can start seeing your early results, your early amazing results right around 6 weeks with brachioplasty, but ultimately recovery is probably 3 to 5 days associated with this procedure. Anybody who has excess skin in the arm is a great candidate for this procedure. And it's really to know if you are a great candidate for an arm lift procedure, but nothing beats an in-person consultation with a board certified plastic surgeon who specializes in cosmetic surgery and specifically arm lift surgery, so that you know exactly who to place your trust in and follow their recommendations to get the best result.